Well, last Thursday was a big day for our country with the Supreme Court's decision on the Affordable Care Act. And really what the Supreme Court was deciding on was an important piece of that act, which was the individual mandate, which is essentially the requirement that all of us have health care coverage and enter into some kind of a health care program. And the Supreme Court's decision on that was, of course, the constitutionality of whether or not we should or can be required to have health care. But the implications of the decision go far broader than that. And it was really a pivotal moment for us because as a country, for all its flaws, the Affordable Care Act was the beginning of really addressing the major issues that we have in our health delivery system. And probably foremost of those issues, and what was at the heart of the act, was that we have around 50 million people who are uninsured in this country. And the principal components of the Affordable Care Act were, number one, bringing about 32 to 33 million people from that uninsured group into some kind of coverage. And number two, making a lot of changes in insurance reform and in how insurance works for all of us. Most of those aspects of the insurance reform have already been adopted and are extremely widely hailed as important parts of any appropriate health plan. So for example, being able to have young people on their family health plan, especially during a struggling economy like we have, was vitally important. The second really important piece to that was the elimination of pre-existing conditions so that you can get health coverage even if you have a chronic illness or something that you're struggling with, that you're not denied coverage because of that. And there were a number of other provisions about being able to renew coverage and continue in some kind of a health insurance plan so that you don't find yourself in a circumstance where you're sick or injured or ill and you change jobs or you change coverage and all of a sudden you have no health coverage. The aspect of the Affordable Care Act that relates to, isn't it time for our country to say everybody gets and needs to have access to insurance, was a little more controversial. And regardless of your politics around the matter, most people agree that one way or another, having 35 to 50 million people uninsured is not good for our country from a lot of perspectives. It's not good for our economy, number one, because it leads to people who can't work, who wait too long to get health care, and who are missing work and unproductive because they don't have access to care. It leads to higher health insurance premiums for other businesses that do buy health insurance because someone has to pay for all those people who have no coverage. And the way it works in our country is that we in healthcare, like I'm at a hospital, we raise our prices, and the people who have commercial insurance pay those higher prices for people who don't have insurance. So I think that the Supreme Court made the right decision, both constitutionally and for our country. And I think it's an important moment for us to be on this journey where we really address some systemic issues in our healthcare program.